guys, and welcome to this week's Mental Monday. So this week I actually have a little bit of a controversial topic and a little more of a debate style topic. So this week I thought I would talk about the connection between medicine and mental health. So in the psychology field, you actually do need to be a psychiatrist to prescribe medication. Psychologists do not have that capability. That is the major difference between a psychologist and a psychiatrist, is psychiatrists can prescribe medication to their patients. And in some cases, that's almost why they're referred to them, because a psychologist has seen them and kind of is thinking they might need medication to help them. So on the issue of drugs and mental health, it can be a really divisive topic. It can be very controversial. A lot of people have opinions about it, and there's actually quite a lot to say about it. Most people ask the question, why is medicine necessary for your mental health? How can anything physical affect your mental health? Well, we've already talked about how the physical health of your body can affect your mental health, but it's even more connected than you think, because your brain greatly affects your mental health and your mental functioning. That's why when you're sleep deprived, you don't function as well. That's why drugs and alcohol can put you in an altered state of mind, and it can actually bring emotions out of people that in other circumstances they would not be so expressive with that. There are also so many hormones and chemicals that affect your mental health and mental state of mind that drugs and your physical body can greatly affect, even mental illnesses and disorders. So it can go down to the chemical level where there's just a chemical imbalance. Now, I have a bit of an opinion on this. Not super strong, but a pretty solid one. For the use of medication in mental health treatments, it can get to the point of being abusive, either by the patient or the doctor, where the doctor is prescribing way more than the patient actually needs and is kind of just masking the symptoms instead of really treating them. And there are other situations where it is actually very necessary. There are different mental disorders like bipolar, like schizophrenia, like depression and anxiety, where those are not always within the patient's control enough even to get treatment for it. There are times where medication can be used to help the symptoms in the meantime while you're working through the problems, and then afterwards you might not need them. Or there are other times where mental disorders like bipolar and schizophrenia actually are probably going to need to be on medication the rest of their lives to stay stable, depending on what of those disorders they have. Because there's schizophrenia, there's also bipolar 1, bipolar 2. There's a lot more information on that, and actually I am thinking about doing a video on mental disorders. So if you would be interested in that, give this video a like and leave a comment. So for mental disorders such as schizophrenia and bipolar, medication can be very, very necessary because those are generally associated with chemical imbalances. Chemical imbalances can change so much in your body, in your mind, and it's not something you can just pull yourself out of or get over. You need help, and in some cases your body just doesn't function the right way, so you'll be on medicine for it to help it function properly. I do know people in my personal life that are on medications like that, and I know they have been in situations where people have made them feel bad for having to be on that medication and even maybe discouraged it, or the side effects just make it difficult to stay on it, but they know they need it because they know what happens when they go off of it, and it's scary. Now to flip to the other side, talking about the abuse or downfalls of drugs and mental health. There are so many bad drugs that just are horrible for you. Like, they may slightly help, but there's so many bad side effects that it makes you feel so much worse taking it. Or the drug is so debilitating taking it that, yeah, you don't have episodes, but you also are kind of just lethargic the whole time and feel really crappy and are almost catatonic. People have said they've made them feel really foggy, lose memory, all of that type of stuff that then kind of they end up going off of it because it just isn't good. And there are cases where doctors abuse that and just throw medication at a patient to get the symptoms away and get them out of their office. Shame on you. The abuse of medication on patients in hospitals and mental health facilities, in long-term treatment facilities. Just the idea with addiction of getting off of one drug by using another. It's questionable, and there's a lot of bad situations that come out of it. For my position on this, granted this is only my opinion, if I were to be in the circumstance of needing to decide whether to prescribe medication to a patient, I would say situations where it is a chemical imbalance would be a situation that it would be necessary to put that patient on medication and continue working with them alongside that medication. There are also circumstances that I would consider it if a patient was so bogged down by depression or anxiety that it was getting in the way of treatment. And if I were to alleviate those symptoms for a small amount of time to break through that barrier and be able to work through what they're going through and what they need to emotionally work through without the cloud of depression or the debilitation of anxiety, that would be a situation that I could see temporarily putting them on medication, on anti-anxiety or antidepressants, and working with them through that and eventually getting them back off of it and in a better mental health state. So I think that's not really a controversial stand on it, but that is what I think about it. That is my view on it. I do believe in it in some situations, but there are many situations where it's abused, and that is very, very troubling, very sad, and something that the mental health community should work together on to make better. So I would love to hear in the comment section your views on using drugs in mental health treatment and how you might feel needing to decide if somebody should be on medication or if you were to decide to take medication yourself for a number of mental health issues. Thank you for watching. If you liked this video and it helped you in some way, please give it a thumbs up and share it with all of your friends. Start a conversation about medication and mental health and medication in general. And if you are not subscribed, click subscribe so you can see when the next video comes out. I do mental health videos every Monday. I will see you in the next one. Bye!